Insurance Tip Tuesday is actually going to be what I like to call the 5 cores of insurance. Whether you're individual or you're working, these are the things that you should look at. As you can see from the last snap, the 5 cores of insurance break down medical, dental, vision, life, hospital indemnity, or an accident plan, or both. Now we can make this a long snap, but I'm just going to go through these. When I'm sitting down, people ask me, is it an HMO, PPO? What type is it? So it's a health maintenance organization, or a PPO, which is a preferred provider organization, HSA, health savings account, PFS, which is a personal financial services or specialist, actually, exclusive provider organization, and point of sale. Now, which of these are the best? It just depends. Also, if you are in a business, they either give you a typical HMO or a PPO, sometimes an HSA. Typical and common is your HMO. HMO, you have a straight up network. These are the doctors that you can see. Sometimes, like the ones I was doing last week, they did have the PPO, which gave them the choice of in-network benefit and out-of-network benefit. And the last and the final is HSA, which is the health savings account. In other words, you get a card, your money goes onto that, and you're able to use that pretty much anywhere, and it just comes off the card. One of the things to keep in mind when you're talking about HMOs, the PPOs, and the HSAs, and so on and so forth is what is the deductibles and what are the copays. If you have a choice, like last week, you have a choice between three, always look at the deductibles, look at the copays, and look at the premiums. Those are the three common things that people will ask me about. What's it going to cost me? What's my deductible? And what does it cost to go to the doctor? The other two conversations when it comes to dental and vision can be rather quick because there's not typically a whole lot out there. You do have the Dental Health Maintenance Organization. It's like your HMO. They're all in-network providers. You do have a PPO, which gives you in-network and out-of-network. But the main conversation is what does it cover and how much does it cost? Next one is vision. What does it cover? Does it cover frames, glasses, extras, that kind of stuff? Basically, you're just asking those common questions. What does it cover? What does it cost me for dental and vision? Or can I get dental without vision? Do I need both? The question is always look at dental and vision. If you can get them separately, get them separately. If they come together, that is awesome. The next one to talk about is life insurance. There is so much to talk about. Let's see if we can break it down. If you're with an employer and they're giving you life insurance, then take whatever you can get, but also look at an extra amount because the most common that they give you is $10,000 or $20,000. Not a whole lot with those, but let's stick with the two common ones, which is term and whole life. There is universal life and so on and so forth. Indexed universal life is one of them, or an FUL, which is a fixed universal life, but we can go into those at a different time. The common on a term life is 10-year, 20-year, and a 30-year. Whole life and the difference between the two, this one actually has a cash value to it. Being able to choose between a 10, 20, and a 30-year term, it would all depend on age. I would suggest the younger you are, you can go with a 10 or a 20. The older you are, look at the 20 and the 30 for sure. Now, the cost differences could be pennies, could be dollars for the most part, but like I say, if it is a given, always go with the given. If you can look at getting a different amount, by them giving you a choice or going out and getting an individual policy, then do so. But look at the 30-year term because then nothing changes for 30 years. Now, whole life, again, you do have a cash value to it. So it will cost you a little bit more because most of that premium, or I should say some of that premium, is going into the cash value, which will give you benefit later on down the road. Briefly wrapping this up, we're going to talk about hospital indemnity and the accident insurance. Hospital indemnity plan, basically what that means is your medical is only going to pay so much towards going into the hospital. Most stays are 20 to 24 hours. If you are admitted and it is 24 hours, then that's when the hospital indemnity plan kicks in, and it'll go towards your bills, and you can help pay or offset those costs by having it pay you, and then you can pay the bill. As far as accidents goes, those are priceless, especially when you have kids. Any kind of accidents that you have, it can help pay your whatever bill it is, if you're going to an ER, if you're going to an urgent care. So I would take a look at both of those plans. If you can get them, get them. The end. I also want you to keep in mind that these are the common, but there is also such things as critical illness with cancer, your long-term disability, your short disability, short-term disability. There's so many to list, but I wanted to keep this about as short as possible, but also give you information and also put out what I call the 5 core. If you have any questions, this is the end, but if you have any questions, feel free to reach out to me here, or you can email me, or you can call me.